We will go to next question. That's Gabriela Sotomayor from Mexican news agency. Gabriela, you need to
Hola, hola.
Hola.
¿Me escuchan?
Can you hear me now? Good. Thank you very much for giving me the floor. It's a pleasure to be able to speak in Spanish. Our concern is that in Mexico, the death rate is of 9.4 in Mexico. Is much higher than in the United States, for instance. So I'd like to know what you know about the situation in Mexico and what's being done in terms of the lockdown, and that there aren't tests being carried out. There haven't been very many tests carried out as you recommend. So what risks are there of just following one strategy? In other words, if you had to choose between a lockdown and public health measures, including testing, which one would you choose?
So I can start, and perhaps Mike or DG would like to supplement. So you had a couple questions in there. The first one about mortality. I think we've spent a little bit of time of trying to describe the difficulties in estimating mortality as events unfold. There's quite some variation in mortality by country if you actually look at how many, if it's defined as how many deaths are reported among the cases that are reported. And there's challenges with that. One is depending on the testing strategy and how much testing is being done, you may be missing cases that are on the more mild end of the spectrum, and so that's important to understand. In terms of mortality and capturing deaths, many countries right now are struggling to capture the deaths that are occurring from COVID-19. There's a very good example across Europe through the Euromomo project, which is capturing excess mortality in many countries across Europe. And excess mortality right now is very high. And so I think it will take some time for us to really understand which deaths are due to COVID-19 directly in terms of the infection causing that death, and which of the deaths are associated with COVID-19, either because someone has died because they didn't get care for some other reason. And I think it's going to take some time. So we have to be careful when we compare mortality from Mexico versus mortality from the United States versus mortality even within a country. And so there are some challenges there. Your other question about whether we do testing or whether we do public health measures, that's not the right question, unfortunately. It has to be all of these measures together. It has to be. Testing alone does not work. Contact tracing alone does not work. Lockdowns alone do not work. It has to be part of a comprehensive strategy. Testing needs to be strategic. It can't be testing every single person in the population. It's just not feasible. It's just not possible. We have tried to be very clear in our testing strategy and prioritizing your tests for suspect cases, testing suspect cases and contacts who develop symptoms. That's the priority. In situations where testing may become challenging because the tests aren't available or the reagents aren't available or the swabs are not available, then you need to be more strategic, even more strategic, and maybe focus on those individuals who may develop severe disease and require care. Maybe focusing on more intensively on healthcare workers. And so it's a much long-winded answer because it's complicated. It depends on the situation that you're in, but it has to be a series of measures that are put in place. It cannot be one situation, one measure alone. The DG has said not testing alone, not contact tracing alone, not isolation alone, not quarantine alone, not lockdown alone, all of these measures. Physical distancing is important, hand hygiene is important, respiratory etiquette is always important. So it's all of these measures that need to be considered when either intensifying them or lifting them.
Just supplement very quickly, and from the perspective of the situation in Mexico, there have been 16,752 cases in Mexico as of yesterday, with 1,569 deaths. But the number of cases is up 76% by week on week, and the number of deaths is up 83%. So there's no question that in the case of Mexico, this is still a very active epidemic in Mexico. I don't have at hand, obviously, the subnational data, so I won't speak to the different patterns that may be occurring at the state level. When you calculate a crude case fatality of those confirmed cases and deaths, that case fatality is of the order of 9%. And that can mean a number of things, but what it usually means at this stage in an epidemic is that there's under-detection of the milder cases. That's what we see in many situations, a higher case fatality, and then as you test more people and you detect more mild cases, that proportion drops over time. It can also reflect, and has reflected, as you've seen around the world, that when the health system comes under pressure and intensive care beds come under pressure, patient outcomes can be affected by the lack of oxygen or the lack of availability of ventilators, etc. So I would say that Mexico is like many countries in Central and South America, is on an increasing trend. More needs to be done in terms of surveillance, testing, and obviously our regional office for the Americas, the Pan American Health Organization, is working very closely with authorities in Mexico to support them in improving surveillance and improving patient outcomes. And I know that Mexico has at least 9 registered trials for clinical trials, and has shown interest or has requested to be part of our solidarity trial. So we thank Mexico for that. We thank Mexico for its openness and data sharing, and we will do all that we can at WHO and at PAHO to support their response, because right now the situation in Mexico is still evolving, still developing, and obviously more needs to be done to bring the disease under control.